Hi there, my name's Elaine. In the last video, we talked about why an appointment-based flu shot model is ideal for this upcoming flu season and how you can effectively promote and register patients early. In this video, I'll be going over how to implement appointment-based flu shots at your pharmacy. With an appointment-based model, your flu shot schedule is entirely within your control. You decide when these appointments take place and how long they last. Depending on your pharmacy's workload or preference, you can choose to limit these flu shot appointments to specific hours of the day or to specific days of the week. This enables you to accommodate for a morning rush, lunch breaks, or the evenings when you have fewer staff available. You can also opt to run clinic days when there are extra staff to help you conduct more flu shots in that time period. 76% of Canadians surveyed this year say it is important or extremely important to limit the number of people allowed on the premises during flu shots, so keep that in mind. When deciding on the duration of the appointments, you should ensure that the interval accounts for environmental cleaning between each appointment. If you're using MedEssis vaccinations, you can easily select which days of the week you'll accept appointments, which hours during the day, and how often you want patients to come in. If you're conducting flu shot clinic hours, select a shorter interval for those times so more patients will be able to book during the clinic. Patients are automatically notified when their doses are available and can self-select their appointment times. MedEssis also adjusts appointments if there are more than 3 people attending, so you will have a consistent workflow and proper physical distancing. According to the CDC, flu shot documentation and forms should be completed at some point prior to the appointment. Pharmacies should also consider going digital with documentation to reduce the transfer of paper. These changes are important for minimizing unnecessary contact time with your patients. Please be aware that if you have a website or online form where patients are filling out this information, that it meets security and privacy standards such as PIPEDA or the equivalent provincial standards. A tremendous benefit of having documentation done early is that you can proactively find opportunities to conduct another injection at the same time, such as shingles or pneumococcal vaccines. One way to tackle documentation is to have the documentation completed at the time that patients book their appointment. Simply walk your patients through the necessary questions while you register them over the phone. With MedEssis vaccinations, people who reserve a flu shot will be sent an email containing a secure and interactive documentation flow. Before they can confirm their appointment slot, they'll need to complete the step online or over the phone with a pharmacy team member. So you'll never have to worry about a patient coming in without a required health card or other missing information. For patients that don't have access to technology, our platform enables your staff to keep track of and assist these patients with their documentation through a phone call. You can also look at their documentation from a previous year to help you make that phone call more efficient. Since documentation is complete ahead of time, patients are less likely to no-show. The day before a patient's appointment, your pharmacy should have a method for reminding patients about their upcoming flu shot. This might include giving your patient a phone call or sending them an email reminder. This is also when you should conduct a COVID-19 screening, which should be done before patients enter the pharmacy. Vaccination should only be administered to patients who are asymptomatic. Finally, the reminder should also relay store-specific safety procedures. For instance, that the patient must wear a mask, in-vehicle shot procedures, or other important information. Prior to appointments, MedEssis sends out appointment reminders, conducts COVID-19 screening, and notifies you if any of your patients have not confirmed their appointments. MedEssis also enables you to easily edit documentation or reschedule a patient's appointment and will notify you of patients that need a phone call. The entire program is paperless for the patient as well. Patients will receive information leaflets about the flu shot as well as a receipt to confirm their injection afterwards. We hope you found this video helpful in planning how your pharmacy will operate during the flu season this year. Please visit medessis.ca for more information about our vaccine platform, which streamlines and automates everything we've talked about today in a simple and secure way. In our next and final video, we'll be going over what to do on the very first day of your flu shot season, including what to prepare in the morning, PPE, and how to conduct both in-pharmacy and in-vehicle flu shots. See you then.